Brandis, since Block Club Chicago first reported about Loretto Hospital's improper vaccinations at Trump Tower, the revelations have been fast and furious. Next came a WBEZ report about vaccination of Cook County judges, and then more Block Club revelations about vaccination at the home church of Loretto's CEO and at a Gold Coast jewelry store that the chief operating officer frequents. And ever since, the hospital's board has been opaque about the fallout. And joining us now are Greg Kelly, the president of SEIU Healthcare Illinois, the union that represents workers at Loretto Hospital. State Representative LaSHAWN Ford, who just stepped down as a member of Loretto Hospital's Board of Trustees over the vaccine controversy. And Wellington Thomas, an emergency room tech at Loretto Hospital and member of the SEIU Illinois Executive Board. Welcome, all of you. I want to get right to it. Representative Ford, I'm sorry, I have to mention we reached out to the hospital, individual board members, and to the executives in question here. None of them agreed to be on the program. We're glad you're on. Representative Ford, you announced your resignation from the hospital board today, saying you disagreed with how the board handled the reprimand of these two executives in question, Dr. Miller, the CEO, and Dr. Ahmed, the COO. What do you disagree with, and how should it have been handled differently?
You know, I think that the people in the community deserve to know the consequences that the executives received. It's a public hospital, and it's it receives state dollars and federal dollars. That's all. I just think that we have to make sure that we're serving the community.
Can you tell us what the consequences are? Because all we've heard so far is just reprimand.
That's right. That's what the order has come down to, reprimand. And that's all I could say. The board is responsible. We have two lawyers on there, and they're very able, and I think they'll get this resolved.
So you can't say more about what that reprimand entails. Wellington Thomas, as we mentioned, you work at Loretto. Were you witness to any improper vaccinations by the hospital, or have you heard about other improper vaccinations beyond what's been reported?
Well, I think they did I think it was reported for the most part as something I've seen. Some of the things we've seen as people that's coming to our facility, people that we wouldn't normally see. Someone that's people that's not actual patients or people that we know that to be in the community. So we do see certain things. Some of the things that did come out is certain things that I found out at the same time you guys have.
But when you say you saw people coming into the hospital that shouldn't have received the vaccines, can you expand on that?
Well, one thing I would say is this. We have many challenges of people that we notice that, you know, we know our community. Me being a ER tech, I know my community. I've been there for 15 years. So I've seen certain people all the time. I've seen co-workers, family, loved ones. But then we get certain different groups of people that have come to the hospital all of a sudden. And it's like, it seems kind of odd. At times, it seems that there's a VIP line for certain people, which kind of, you know, makes you wonder what exactly is going on.
You say there was a VIP line for certain people. How could you delineate what was VIP versus what was a proper vaccine?
Well, I'll give you an example. One of our coworkers was trying to get her vaccine, and when she tried to get it, it was some problems as far as they say, well, these people have to go first, but she was actually scheduled at a certain time, and then somebody had to actually step up and try to let the folks know that who was giving the vaccine that, wait a minute, this is a coworker. This is the actual worker that works in the hospital. Unfortunately, some people, I'll say, the group doesn't look like folks that we would normally see. As far as the VIP line, you can see that they have different groups. They have certain, you know, delegates, I guess, or certain groups that be pushed to the side, even when there's a long line.
So you're saying VIP, so it's folks that you know that don't live in the community. Is there evidence that there was connection with these folks to the chief operating officer, Dr. Ahmed, as has been reported with these other improper vaccines?
Well, we haven't gotten no confirmation exactly how connected they are. Some of our work is definitely from, you know, obviously what they've seen. They feel that there are some serious connections there, but there's nothing factual or nothing that's been proven yet.
So this is something you're still looking at. Greg Kelly, you know, the other issue here is it's been reported that the chief operating officer, Dr. Ahmed, who's at the center of a lot of these allegations, He, on record, has a $2.5 million condo at Trump Tower. He, according to Block Club, was purchasing at least tens of thousands of dollars of jewelry and watches at a jewelry store that then held a pop-up vaccination site. Are there questions here as to executive compensation and how exactly Dr. Ahmed is having this kind of spending power and making money leading a small community hospital in Austin?
Yeah, I think you've got to ask him. But I will say, just it's important to note that our members at Loretto have been working under this pandemic now for over a year. And they have seen firsthand since March, February, maybe even earlier last year, the impact of COVID on the Austin community. And so you can imagine sit here a year later and to see one of the ways out of COVID being abused by those charged with the responsibility of overseeing it. And so that's really the overarching point that I think we make here. Our members have been on the front line since the very beginning, suffering, some getting sick themselves because they worked on the front lines without proper PPE, poorly paid. And yet here we are, finding out once we've got an actual vaccine to deal with this, that it's not being handled properly. It's really shocking.
Not being handled properly. Representative Ford and the board is tasked with overseeing what exactly happened. Have you learned any more that you can tell us about how these vaccinations happened at Trump Tower, at the jewelry shop, the Cook County judges?
No, I haven't learned anything more, but what I have learned is that, that the focus must go back to supplying the Loretto Hospital with vaccines so that the community could be protected. And with the community being protected, the city of Chicago is protected. And there's a lot of confusion that we have to straighten out because we hear that the city will not be sending first doses. People that's looking for second doses, they don't understand all of that. They think that they're not going to be able to get their second dose. So we have to focus on getting this behind us and making sure that the community is protected.
And as the mayor said, there's a pause on the distribution of that first dose, although they are still giving out second dose. Greg, you wanted to jump in?
I do. I think what Representative Ford is right on point. There is tremendous confusion in the community about what exactly is happening. There's no transparency around how you even sign up to get in line for the vaccine. There's no clarity around, is it even available now? And so I think job number one right now really has to be educating the people of Austin about what the availability is to the vaccine.
I want to go back to Wellington because I want to go back to your allegation here that you saw a VIP line of folks that were not from the community, were not properly there to get a vaccine. Do you have any other questions? Do your coworkers have any other questions as to the administration here, the Chief Operating Officer, Dr. Ahmed, again at the center of these allegations, and the CEO, Mr. Miller?
Well, I think one of the things we want to question is, well, why? Obviously, that's the biggest thing. I think the biggest thing, going back to what Greg and Representative Ford says, that we want to protect our community. Most of us have worked here for years. I've been there for 15 years. And our job is to protect our patients, protect our loved ones, and protect the people that work there. And, of course, they've been supplying vaccines for the workers, but then it seemed like, it's been a skip. In other words, you see other different people in the hospital that you would normally see. And then, of course, you do see people from the community. But then there's been a lot of questions as far as how do we sign up for the vaccines? How is it being structured? How can people communicate with the hospital as far as getting their first and second dose? Like Greg said, education is a big thing, and also accessibility. The problem is we have a lot of older people that's working that want the vaccine, but they don't know how to get it. But then, we have other facilities have the internet.
All right, a lot of open questions here that we still just don't have enough answers to, but our thanks to Greg Kelly, State Representative LaSHAWN Ford, and Wellington Thomas.
Thank you, Paris.
Thank you so much for having us.
Thank you.